99.3 The Vine. Good morning, it's Bob with a very special edition of Healthy Communities. Dr. Monica's in the house this morning, but I can't pronounce your last name properly, so I'm going to let you do it for me rather than embarrass myself and you.
It's Divakaruni.
Divakaruni. That's a great name.
I'll make you say it 10 times fast later.
Divakaruni. There's 3. I got 3 in the bank. We'll do the other 7 later. So we're going to talk about women's health today and AFib, atrial fibrillation. Is that it?
That's it.
So I did a little bit of homework, but what do you want to focus on this morning?
For atrial fibrillation and for women's health, I think the importance is trying to figure out how people can live better lives. And for both women with cardiovascular disease as well as people with atrial fibrillation.
So AFib is kind of like a heart murmur?
No, atrial fibrillation is an irregular rhythm of the heart, often when basically their upper parts of the heart and bottom parts of the heart, they're supposed to electrically communicate. And when the circuit goes bad, if you will, there's no communication anymore. And the top parts of the heart basically quiver and have no organized activity and can cause people to have very rapid heart rates and feel pretty terrible.
Is that kind of like a little heart attack? If it's
not really like a little heart attack. It can cause heart attacks or be caused by heart attacks, but in and of itself is not a heart attack. It's essentially a rapid, irregular rhythm of the heart that can cause people to feel very tired, weak, short of breath, chest pain, dizzy, lightheaded, generally terrible.
How is it that coronary heart disease is the number one single killer of women over age 25? Really?
Really.
Number one?
Number one.
So how do we correct that?
I think a lot of it has to do with community awareness and physician awareness. It used to be thought that women were protected from coronary artery disease because of estrogen, because of progesterone, and it turns out that while that may be partially true, coronary artery disease tends to be underrecognized in women because it presents often differently than it does in men. It doesn't have the stereotypical, crushing chest pain where people drop to the ground, the very dramatized versions that you see on TV. Women often present differently. It's often underrecognized. They're often too caught up taking care of their families or their spouses or their children to notice that they're having a heart attack. And so generally the mortality is higher and symptoms are not recognized as quickly.
So what can we do to keep an eye on it? Should women go have an EKG occasionally? What do we do to keep an eye on it?
I think women need to pay attention to their bodies, and I think people out there who are having symptoms of shortness of breath when they walk, who think that they're just maybe getting old, or people who have a little bit of chest pain who think it's just because they lifted their child or lifted their grandchild in a funny way, I think realize that heart disease is just as common in women as it is in men and kills more women than all forms of cancer combined every year.
That's scary. So what can we do to stay healthier, or women in particular? I mean, should we just stay off the saturated fats and just eat right, drink a lot of water, same thing, exercise?
Unfortunately, that is part of it. Of course, it's eating healthy and exercising and limiting your saturated fat, but it's also seeing a doctor and trying to establish your baseline risk. Everybody has risk factors, and it's a matter of seeing a physician and controlling the factors that you have that are putting you at a higher risk for heart disease, such as your diabetes, if you have high blood pressure, high cholesterol, high stress levels.
Bad.
Bad.
Is there a genetic component?
Of course. There's a genetic component for everything.
So we're disposed to be whatever we got. We have to be careful of.
Well, if mom and dad had a heart attack when they were young, then you are at a higher risk.
So we're predisposed to look out for that.
You got it.
So you just got to take care of yourself.
Exactly.
All right. Well.
And doctors are there to help. I think that's the point.
So the trick, you need to have a doctor, and you need to check in with your doctor, and then your doctor will let you know when it's time to be tested, right?
You got it.
How often should you be tested?
Depends on what you want tested for. I think your cholesterol should be checked at least, it should be checked at least once. And if it's totally normal, then you can go for a little while without checking it again. If it's
At what
abnormal. I think it totally depends. It's a
20,
case by
25?
No, I think most people don't need their cholesterol checked at 20. There are some that do. If you have a very strong family history of early cardiovascular disease, your dad had a heart attack at 40, then 20 is not an unreasonable age to check your cholesterol.
Okay.
Most people closer to 40 is probably a reasonable time, and it's really a case-by-case determination for everything in between.
So you're having a seminar?
Indeed.
On May 15th?
May 15th.
So this, actually, I'm really interested in this. So it's a half an hour. Are you going to be leading the seminar?
I will be speaking.
You will be speaking? You're not in charge?
It's a crew of 3 of us, yeah.
Really? They all look like you?
No, actually, I'm distinctly different from the others.
What hospital do you work at? Do you work out of the Queen?
St. Helena Hospital.
Oh, St. Helena. No ADR. Love it. And beautiful trees. What a great place to work. Huh? Did you get here and go, I can't believe this hospital is put right in the middle of the woods like that?
Well, the view's quite lovely, I must say.
It's a beautiful place.
It is.
So your seminar's May 15th.
May 15th.
Tell us a little bit about that.
In Santa Rosa, this is essentially intended as an educational seminar to help patients understand atrial fibrillation as an entity and also understand their treatment options. Because there's a spectrum of treatment options depending on where you lie on the spectrum of atrial fibrillation.
Okay, and this is just open to the public. You can just show up. You don't have to make resis?
No, I think there is an RSVP required. It's a room with limited capacity, although I think it's a fairly large limited capacity.
Okay, so how would we contact? Do we know that answer? I have Vintner's Inn at 4350 Barnes Road in Santa Rosa in the Rose Ballroom. It says to register at 6 p.m. Here, I'm going to make you go on a mic. This is the first time.
Hi. You can register at adventisthealth.org and click on seminars. There's a phone number, and or you can register right online.
Okay, there you go. We have the information. Okay, now June 6th, you can learn about breakthrough treatment options for perennial vascular disease. Oh, I got that word wrong, didn't I?
Peripheral vascular disease.
That's what I meant. It's early. We're rolling. It's warm out. So that's June 6th.
June 6th.
And that's in town. So you're going to be speaking at that one as well?
That will be my colleagues.
Just your colleagues?
I will not be speaking at that one. But that
I'm
will be my
sure
colleagues.
They're fantastic.
They are fantastic.
So that one is 6 p.m. registration, 6:30 to 8 p.m. at the Silverado Resort and Spa, 1600 Atlas Peak, like we didn't know where that was at, in the Vintners Court. All right. Well, Dr. Monica, you have made my morning. What's going on? Did you have a good time this morning?
That was fantastic.
It was fantastic, wasn't it?
Total barrel of monkeys, yeah.
Yeah, cool. Well, thanks for sharing with us and helping women stay that much healthier. We'll see you soon.
You're welcome. Thank you.
All right. Well, let's keep it rolling.
Community Grapevine.